The child care certificates helped me go to school, get my education, and have child care, because that's hard. I know I have friends who couldn't go to school because they didn't have child care.
If it hadn't been for child care, I wouldn't have been able to work. I would have had to stay at home.
There's a need for them. It really is a need, because I've seen hard-working parents that if the program was not here, would not be able to have the opportunity to work because they wouldn't be able to afford the child care.
For many low-income individuals trying to move from welfare to work, subsidized child care is the key. Child care allows these parents to find and maintain stable jobs. And for a single parent with 2 preschool-aged children, child care subsidies can reduce costs by more than $500 per month. For children, quality care and a safe, secure environment can provide positive early childhood experiences. These experiences help build a strong foundation for learning and for success in life.
I even heard a child come into the center and say, "Oh, Miss Felicia, I saw a red stop sign. You know, I saw an octagon-shaped stop sign. It was red, S-T-O-P, stop." So they're excited about learning. And what's good about it is they may not even know that they're learning, but they are learning and they're excited about it.
Mississippi's federally funded child care voucher program, administered by the Department of Human Services, helps low-income parents pay for quality child care. Unfortunately, this program is inadequately funded, and only about 30% of Mississippi's eligible families receive this assistance. The rules governing the program are also problematic, since they often make it difficult for parents to qualify and for child care providers to receive their payments.
We know from research that if a parent leaves welfare to go to work, they're 82% more likely to still be employed 2 years later if they get child care.
And it's also important for the future of the state. For children who access quality child care, they are more likely to have better outcomes later on in life. It's a strategy that's important both for the short-term and the long-term economic development in the state. If we invest in quality early childhood education, it's more an investment rather than an expense. For the children who are in an early learning environment, they're going to perform better in school later on.
I think we are drastically below where we need to be in the provision of child care for our constituents. Serving on the Department of Corrections Committee in the Senate, I can see where we're spending a lot of funds for, incarcerating people because they didn't get the education they needed up front. So we either pay now or we pay later.
In the short term, we can make the system friendlier and more accessible to more people. And I'm not trying to be critical of the system or the people who run it, but I think that the system could be overhauled to ease their burden. There are a lot of administrative requirements that don't need to be there, and that would help the system as a whole.
The policies in Mississippi's Child Care Certificate program are rules that are created by the Department of Human Services, and the Department of Human Services has the authority to make changes in those rules very easily and administratively without federal approval or without state legislation being required.
Currently, the rules designed to keep ineligible families from receiving assistance actually keep thousands of eligible families from participating. Parents are required to prove their eligibility every 6 months, providing more documentation than required even by the federal government. Even worse, administrative errors abound in the current system, with many eligible parents denied assistance. The extensive paperwork and bureaucratic headaches would be a challenge for any family. It doesn't have to be this way. The rules create problems for child care providers, too. The frequent redeterminations of eligibility make the program an unreliable source of income for providers. And the state reimburses only about 2/3 of the market value for child care services. This discourages providers from participating and often means financial hardship for those who do. It doesn't have to be this way. Although current child care funding is not adequate to meet the needs of all eligible families, federal TANF dollars could be used to serve thousands of additional children. But in recent years, millions of these dollars have gone unspent, not used elsewhere, simply not used at all. It doesn't have to be this way.
Consider the fact that we're, lowest in terms of income, the fact that we want the best for them, the fact that, we state we don't want to leave any child behind. And with the money, since the monies are there and are available, let's invest it into the children, who are our future.
The fact that we're leaving money on the table at the end of each year shouldn't happen. We should be providing services for kids who need that in this state.
At this point in time, we're only able to serve about 30% of the children in our state who qualify by income for a child care certificate. There is a huge unmet need, and we need more funding in the program in order to meet that unmet need. We would like to bring in new partners to help us accomplish changes in this child care delivery system so that it's stable and it provides a reliable service and a quality service. There are policy changes that can be made very easily, and we need more people to help us communicate how important that is to accomplish to policymakers in the state.
The good news is you can help. You can call for increased funding for this vital program. You can also support rules changes, removing the obstacles that keep so many eligible families from taking part. As Marian Wright Edelman says, no parent should have to choose between the job they need and the child they love.